And it's my pleasure to introduce the first speaker, Liz Rosenbaum. Liz is a community activist fighting against toxic firefighting foam, otherwise known as AFFF, that polluted the Wide Field Aquifer in El Paso County, Colorado. In 2016, she worked with other community members to start a coalition, and as a result, state legislation to ban the training use of these chemicals actually passed in 2019. She also, in that legislation, increased the fines for corporations for polluting neighborhoods, which leads to a future of prevention rather than reaction across Colorado. Since 2019, at least 8 other bills have passed to also protect vulnerable communities so that residents can have a voice in the cleanup and the reparation processes. Her community still has persistent PFAS issues, and they seek to continue the lifetime commitments by the Department of Defense to continue to pay for the filtering process. This summer, the community will be participating in health studies through the CDC and the Agency for Toxic Substances and Disease Registry. Welcome, Liz.
Okay, so thank you for having me as a speaker today. I live in a rural area, so the video may not sync up with what you're hearing me say, so I apologize for that. Next slide, please. So in 2016, we found out as a community that our drinking water had been contaminated with PFAS, and they did this in a group setting. It came out in the newspaper, and when it came out officially, our local water district managers were not even notified. They found out, like the rest of us, through the New York Times. So alerting the community of what was happening started off on the wrong foot to begin with. So from 2016 to 2018, we spent the majority of our time just learning about PFAS and the different government agencies that could do something about it. Many people in the community were angry with the water districts. So part of our community activism was partnering up with the water districts to say they didn't put the chemical there. They found out when we did, and we're trying to do the best we can. From 2018 to currently, we've had legislation which we termed as turning our anger into action, trying to figure out how to navigate this complicated system. Shirley Chisholm has a saying, bring your own chair to a table. But in our case, we couldn't find the table. So we invited everyone to ours. And by doing so, we connected with Region 8 EPA, our state health department, CDPHE, our local county health departments, county commissioners, elected officials, city and state, and we tried to navigate how can we do something about this, because we had been contaminated in this community multiple other times, and litigation was not working. We had Rob Bulat as a guest speaker early on, and he talked about litigation and legislation. So that's when we started looking at the EPA has a 6-year process for the Clean Water Act, but in the meantime, we could do state legislation immediately. Next slide, please. So we have some forgotten families, not only in our community, but across the United States. Military families move about every 3 to 4 years. We came into Colorado Springs area, southern El Paso County, in the year 2000 when the Army stationed my husband here, and we loved it so much he didn't re-enlist, and we just stayed here, living in this community since 2003. We need access to health studies for military families besides just the military members. You'll hear Mark Favors possibly talk about this later. He's been advocating for VA assistance, like Vietnam veterans had access to assistance through the VA and disability with Agent Orange, my dad being one of them. So we need to include all branches of the military who are using these foams. My son is in the Navy. We're going to go see him this week on the East Coast. He has to be certified with these foams as part of his job. And proper use of these foams needs to be monitored. In the past, chemical companies lied and said it was a surfactant like soap, and no one really understood the deadly consequences of these chemicals. Rural families in my community whose PFH excess levels are under the advisory of 70 parts per trillion are not being provided the opportunity of non-detect levels like the 4 municipalities have been given since 2016. We're finally getting legislative bills passed in Colorado to have oversight committees. We have one going through this legislative session that is almost done. It's passing really well, and it will create a committee of people to pay particular attention to our area as well as Commerce City and a few others where there's been so many contaminations. We have an individual group of people that look at all the permitting that is associated with major industrial sites to see if they've pulled proper permits and that they're following the new permitting that the state health department is now has the ability to do. Military families are moving in and out of our community every 3 to 4 years, back and forth. You know, they're stationed here for a little bit. They do 2 tours in a different area, and then they come back, and many retire. We have a larger population of people of color, and our coalition has participated specifically in 6 legislative bills since 2019 to protect ourselves. There's no hospitals in the southern half of our county. And we've had 2 other major contaminations that led to litigation. Here's a quick map to show you. Here's El Paso County. You can see that line drawn pretty much down the middle. There's 2 markers, the Air Force Academy and Evans Hospital on Fort Carson. Those are military hospitals. In our end of the county, we hear a lot, well, you could just go to Evans Hospital if you need emergency. That's not true. Even when we were here in 2000, I was pregnant with my son. We were in the Army. I did not have access to that hospital to give birth to my son. So it's very limited on what they provide. So you see the top, that indicates that there are literally 2 hospitals built on top of each other. We barely have anything in our end of town that would even constitute a clinic for any specialty diseases, right? So this lack of healthcare options creates another avenue for contaminations to occur in our community because there's literally nothing here to monitor situations. If we don't have a consistent level of larger doctor offices, then the majority of our people are going more north and they're dispersed throughout other family practice places, so it's less likely to pick up that there is something occurring in our community. There's several communities where unique cancers are kind of like little cluster cancers, but those are only known because of the neighbors know each other, not because doctors' offices are picking up that there's something wrong. Next slide, please. Recently, just this week, we had the CDC ATSDR PFAS exposure assessment community levels released. We were able to do this last summer. The ATSDR set up inside or outside of the Security Fire Department, one of the places that we met monthly with our coalition meetings. And you can see that we are very contaminated here. And from 2019 to 2020, our levels have dropped. So in the 4 municipality drinking water areas, people are now receiving water at a non-detect. But the outlying places, like where I live now, more rural, southwest of Peterson Air Force Base and the municipal airport, we don't have the advantage of a non-detect. So in 2019, I participated in the initial blood study through Colorado School of Public Health, and I had 19 parts per trillion of PFAS. And then in 2020, when I got to participate from the 200-person study to the 50-person study, my levels had dropped to 12. This year, we're trying to set up the health study version, health study part of this, and just to show you how incredibly difficult it is in our community with access to healthcare, we literally couldn't find a clinic-type area building to set up a temporary clinic to get this done. And we looked for over a year. Next slide, please. So we keep fighting for safe communities. We turn our anger into action, and we're making lifetime changes to make sure we are never contaminated again. Our state health department now has the ability to fine companies $50,000 a day instead of $2,500 a day. So we have changed the course of responding to contaminations by actually making it more expensive for large corporations to contaminate us than it is to do the right thing. Half the battle for us was trying to figure out how to ask the right questions to get what we needed for a clean and safe community for our working families. By having monthly meetings every Thursday at 6:30 for 4.5 years, by having amazing scientists come in and talk to us and representatives from the Region 8 EPA, we were able to learn new vocabulary and definitions, and several times our community members would just be frustrated and say, let's pretend I'm using the right words that you need to hear to give you power to help us hear. So working with communities, please take that into consideration as you're talking with us. Over-explain things. I have a weekly column in the local newspaper, and every time I say PFAS, PFAS, PFOA, PFHXS, I give the definition. Whenever we're in the news again, there's new people who live here who, become very concerned, thinking, our water's contaminated? Well, yes, it is. However, it is now filtered to a non-detect. We're not a low-income family community anywhere here. Last year, zip code 80911 was the hottest real estate market in the nation. So there's no reason for our community to always have environmental justice issues. So I thank you for your time today and look forward to any questions that you may have. Here's how you can reach out to us for our coalition. We are not organized as any financial type, any type of financial group. We're not a 50c3 or 4. We just meet together as a community. We have a Facebook page. You can also reach me at my cell phone or my email. So thank you for your time.
Thank you, Liz. That was a very impressive speech, and you've taken such a great role in advocacy. I'm truly impressed. And I have a question just based on my experience here in Wisconsin. I was impressed that we got that legislation passed. When we tried to get PFAS legislation passed in our legislature, we got a pushback from industry that was so strong that the legislation went away. Did you have any problems with pushback from industry and the cost and what it would be?
Yeah, that's a really good question. We did. We had to find House District representatives who were not our own to pass this. So there's definitely a political divide going on here. The environmental justice bill I talked to you about, it only had a fiscal note of $100,000, and our state rep voted no on it because of the price tag. But the DOD has spent $43 million in water filtration systems, so it's cheaper for prevention. One thing that we really lucked out on is we had the Colorado Sierra Club team up with us with their lobbyist funds. And if we weren't organized, we wouldn't have had that team up. Earth Justice does a really good job keeping me in the loop. So it's just, you know, after years of doing this, that the environmental groups have tagged on and kept us updated. Because, you know, none of us in our group get paid for this. We're doing this on our own time. And I would say we have about 300 people in the coalition. We have 30 that really do a lot of the work. And then there's 5 of us that do the main organizing portions of it. So I've organized it really well. And I think we snuck under the radar with the environment, with the what did you call them? The industrial groups. We would go up to Denver and testify, and we lucked out that we had a pretty good working relationship with a lot of legislators, and we would work ahead of time and say, please ask me this question when it's my turn. And then the questions we would have them ask us would specifically pertain to, why do you want to limit financial growth to an industry? And I said, well, it costs them more money in litigation to do the wrong thing than to do the right thing, and they've got to stop killing all of us who they want us to work for them. So we just kind of changed the dialogue, and on one of the legislative hearings, they sent a newbie person they had just hired who didn't have any experience in what we were doing, so we just kind of lucked out that day, I think. Kind of serendipity.